Have you ever felt completely lost staring at the alphabet soup of mental health degrees? Psychologist, psychiatrist, counselor, social worker, it is a lot to take in. Well, today, in this explainer, we're going to look at this entire landscape through a completely different lens. How these experts are actually taught in the classroom. Because it turns out, the classroom entirely shapes the clinic.
There's this fantastic, kind of tongue-in-cheek quote from a mentor in the field that really hits the nail on the head. It highlights a massive cultural difference in how these professionals learn. If you want to truly understand a mental health profession, you absolutely have to look at their educational training model. What they study fundamentally dictates how they're eventually going to treat you.
We're going to map this all out by anchoring ourselves with clinical psychology, breaking down its core pillars, and then comparing it to psychiatry and the other sister professions. Then we'll dive right into the exact training blueprints used today and the one core concept that unites the whole field. All right, let's jump right in and anchor ourselves by defining the field of clinical psychology. There are obviously a ton of fields out there trying to reduce human suffering, but clinical psychology stands apart because of its specific academic tradition. When we teach clinical psychology students, we aren't just showing them how to be empathetic listeners. We are literally training them to integrate rigorous psychological science, deep theoretical knowledge, and clinical practice to really understand and alleviate maladjustment. So, how exactly does that scientific foundation translate into their day-to-day education? It essentially boils down to 4 core pillars that are drilled into every clinical psychologist from day one. First, a heavy emphasis on science. They are taught to rely strictly on observable, empirical evidence. Second, they focus heavily on maladjustment, meaning they are specifically studying abnormal behavior and emotional suffering, not just typical everyday psychology. Third, a deep emphasis on the individual. And fourth, they are taught to be a dedicated helping profession, learning highly specific psychotherapy interventions to actively improve lives. And this distinction right here is absolutely crucial to how they are taught to think. Most general sciences operate on what we call a nomothetic level, searching for broad, universal laws that apply to everyone. But clinical psychologists, they are taught to work on an idiographic level. They have to take those broad scientific principles and figure out how to apply them to the incredibly messy, complex, and highly unique life of the single person sitting across from them in the therapy room. Now that we have a solid grasp on psychology, we have to tackle the biggest point of confusion out there: the great divide between clinical psychologists and psychiatrists. It literally all comes back to the classroom. Psychiatrists are physicians. They go to medical school for 4 years, followed by a residency, and their education is deeply rooted in biological facts and medical authority. Psychologists, on the other hand, are shaped in university psychology departments. They earn a PhD or a PsyD, and their classroom culture is one where intense theoretical debate and psychological research aren't just encouraged, they're the absolute norm. Because they're taught this heavily biological model, psychiatrists primarily view and treat mental disorders as physical illnesses, which means their go-to tool is psychopharmacology, or medication. Psychologists are taught multiple competing theoretical models, like cognitive, behavioral, or psychodynamic theories. Because of that training, their main tools are psychotherapy and psychometric testing. Basically, they're conditioned to talk, test, and analyze rather than prescribe. But what about the rest of the field? The way we teach professionals in other academic traditions creates entirely different yet incredibly vital sister professions. The specific university department you study in fundamentally changes your professional DNA. It dictates exactly what you're trained to look for in a patient. Counseling psychologists, for instance, are often educated in faculties of education, originally focusing on normal life transitions, though today they definitely treat severe psychopathology too. School psychologists merge education and psychology to focus on learning difficulties. And then you have clinical social workers, who go through master's programs that deliberately teach them to focus on the broader social determinants of health, things like housing and welfare, rather than doing original clinical research. And beyond that, we have an entire spectrum of highly specialized roles, all cultivated in totally different ways. You've got psychiatric nurses trained for inpatient care and psychoeducation. You have child and youth care workers who often earn 2-year college diplomas to provide absolutely critical frontline residential care. And mental health counselors might get specific certificates to focus exclusively on single issues like addiction or trauma. Every single level of teaching serves a distinct, necessary purpose in this ecosystem. Let's zoom back in on clinical psychology for a second and look at the exact blueprints we use to teach these specific experts today. Even within clinical psychology, students aren't just churned out of a uniform assembly line. Depending on the graduate program, a student might be taught under the Boulder model, which aims to make them equal parts researcher and clinician. Or they might go through the Vail model for a PsyD, where they were taught to be a consumer of research but focus almost entirely on direct clinical service delivery. And then there's the clinical scientist model, which is super rigorous and heavily restricts training to only empirically supported methods, turning out fierce scientific researchers. So with all these vastly different classrooms, different labs, and competing training models, you might be wondering, is there anything actually holding this field together? Yes, there absolutely is. Today, modern mental health training is heavily united by one core concept: evidence-based practice. Whether we are teaching a psychiatrist, a social worker, or a psychologist, they are all being instilled with this one golden rule. When treating someone, they absolutely must synthesize the best available research findings, their own professional clinical experience, and, crucially, the unique values and preferences of the patient. So, the next time you or someone you care about is staring down that alphabet soup of degrees and titles, don't just look at the letters after their name. Remember that understanding their classroom, knowing exactly how they were taught to view human suffering, is the real secret to finding the perfect fit. Knowing how they were taught, which expert would you trust with your mind? Thanks for joining me on this explainer, and keep asking the right questions.